Now we're going to have a look at the muscles of facial expression. As you can see here in our virtual dissection, we've removed all the skin and subcutaneous tissue and kind of created a little bit of an idealized version. Over to the left of it, you actually have this here. This is a real cadaveric dissection, and we can see if we can correlate the muscles on the virtual one with the real one as we move forward. Okay. So the muscles are in the subcutaneous tissue, yeah, and not only in the face and neck, but also in the anterior and posterior scalp. These will move the skin when the muscles contract, of course, and that will change our facial expressions. That'll convey our mood. It's very, very important because this is how we communicate with our outside world, and actually we do so way more than we might actually anticipate. Our facial expressions are very important. However, some people are bad at facial expressions, and some people might be good at facial expressions, but bad at reading facial expressions. Also, most of these muscles will attach to bone or fascia and produce their effects by then pulling on the skin. As we're going to go through this, I'm going to try to focus on muscles that you might encounter in a laboratory setting. All of the muscles of facial expression are innervated by the facial nerve. I guess that's kind of a no-brainer. That would be cranial nerve number 7. And as we're going to move through this lecture series, you're going to learn that the facial nerve is actually very interesting because it can do way more than just innervate a few muscles of facial expression. It also carries parasympathetics and special sensory fibers, for instance, for taste. Highlighted here is the frontal belly of the occipitofrontalis. Yeah. Some books will refer to this muscle as the frontalis, but if we think about it, technically it should be called occipitofrontalis because you have the occipitalis back here, and then it is connected via the epicranial aponeurosis to the frontalis, so why don't we just call it occipitofrontalis? You have a muscle that is circling the eye that will be called the orbicularis oculi, and to be more precise, I would say we have the orbital part here, and the one that's on the eyelids is called the palpebral part because the palpebrae are the eyelids. Then you have the zygomaticus major muscle here. You have the zygomaticus minor. This is in lab often, destroyed or often not dissected out very cleanly. You have the levator labii superioris. Again, the name kind of indicates what it does. Levator, lift, labii superioris, upper lip, lifts up your upper lip, right? As if you're kind of creating a little bit of a sneering expression. Then we have the levator labii superioris aliquae nasi. That is kind of a mouthful, and in many labs this one's actually not dissected out, but if you are lucky and have someone who is skilled at this, you might be fortunate enough to see this in lab. You have a small muscle here directly across the bridge of the nose, the nasalis. The orbicularis oris, as you can see, this is kind of like a sphincter around the mouth. And then you have a muscle that is often activated by people when they get their tests back and it's a bad exam grade, which would be the depressor anguili oris. And people with small kids like me, they will see that kids are very good at pulling the corners of their mouth down when they're upset at that, and luckily you can snap out of it quickly by activating the other muscles that will pull up on the corners of the mouth, like for instance the levator labii superioris and the zygomaticus major and minor. Then you have the depressor labii inferioris down here, and directly on the chin, the mentalis. If you are curious about the functions of each of these muscles in detail, this is pretty straightforward. You probably already know how this works. You just click on the muscle of interest, and then you can activate a little tab that'll give you all the information that your heart desires. Like you can see here now, this is some more information about the mentalis if you don't know how to pronounce it.
Mentalis.
Mentalis. There you go. And here's all the information you want. Just click on the muscle and you can learn whatever you need to know.